Health insurance, riding in an ambulance to the emergency room could mean getting billed thousands of dollars down the line. When you pull up your Uber or Lyft app, you know exactly how much it's going to cost you to get to the hospital right off the bat. But health professionals are saying it's what happens during that ambulance ride that could make the life-saving difference.
Had people say I'm a lifesaver, and so it's nice to get those comments back from them.
Karen Plotkin has often been the safe ride Uber and Lyft passengers can count on in the Kern River Valley.
Getting them home safely or to their destination safely.
In a community where health care is limited, that's even meant picking up riders for medical emergencies.
He actually was chopping wood and chopped his finger off.
Plotkin says she took the rider from Lake Isabella to a Bakersfield hospital.
He was just real quiet. I think he was in a little bit of pain.
About a 40-mile trip.
Probably about an hour.
For under $50. That price tag potentially thousands of dollars less than what an ambulance ride would have been, depending on insurance coverage. Research shows it's a growing trend among patients to opt for a cheaper choice, an Uber or Lyft, to avoid getting stuck with an ambulance bill.
That's not what they are trained to do. That's not what what their job is. They're simply wanting to pick up a passenger from point A and get them to point B.
Health professionals are pointing out how the savings could actually cost you much more.
In healthcare, minutes, seconds count.
It's not like we're just a taxi giving you a ride to the hospital. We have paramedics that are trained to provide advanced life support medical care from the point they arrive on scene and during transport to the hospital.
They say there's a steep difference in price for a reason, beginning with the treatment on scene, the lights and sirens to get to the ER faster, and the treatment on the way. The back of an ambulance providing invaluable life-saving technology.
It's basically a small hospital room,
giving emergency rooms a leg up before the patient even gets there.
The medical personnel in the ambulance are communicating with the hospital.
If they see that the patient is having a heart attack, prior to us arriving at the ER, they're going to be able to activate their cath lab team, their cardiologist, and be ready for us when we arrive, which is going to save very precious minutes for the patient and their condition.
And Plotkin agrees. She says as an Uber and Lyft driver, there's only so much responsibility that she's willing to take on.
Yeah, that would be a little scary. I mean, if it has something to do with the heart, yeah. I would think that they would need 911 medical attention at that point.
And that's what Uber and Lyft recommend. Lyft saying in part, if a driver encounters a passenger with an emergency situation, they should contact 911. After that, they should report the incident to our 24/7 critical response line so we can take appropriate action. Uber saying in part, Uber is not a substitute for law enforcement or medical professionals. In the event of any medical emergency, we always encourage people to call 911. Plotkin says for her, it's a fine line to walk between being the ride people can count on when they need it most and taking on more than she can handle.
I don't want to be responsible for not getting there fast enough and breaking laws to get there. Yeah, no, I don't really want to have that pressure on me.
That being said, she's relieved to know her services came through for her last ER rider.
It was nice getting that note. Then I knew that, he was okay.
Now, when it comes to appointments, Uber and Lyft do offer a special service to get patients to the doctor's office. You'll have to check with your healthcare provider to see if that's something they offer. Sometimes they even cover the cost. In downtown Bakersfield, Alyssa Flores, 23 ABC.